Public discourse about health insurance has become so politicized that very few address policy with neutral objectivity. When legislators judge every reform in terms of whether it protects or threatens Obamacare, the people are bound to lose. Obamacare, or the Affordable Care Act, contains critical design inequities that need to be corrected, such as the individual mandate. The mandate hurts vulnerable segments of the population and was unpopular with 2/3 of the American public. This is why Congress eliminated the penalty associated with the mandate in December 2017. But a number of Democrat-controlled state legislatures have sought to resurrect the mandate at the state level. Last May, Vermont passed a law requiring citizens to buy health insurance or face a penalty. Lawmakers postponed finalizing the nature of the penalty until last November, that is, after the election, by which time a working group was expected to have decided on imposing a tax or some other enforcement mechanism for noncompliance. Now we learn that the House Health Care Committee has decided that a tax-based penalty ought to be imposed on Vermonters who can't afford health insurance. In addition, the committee has decided that Vermont should eliminate the religious exemption from the mandate that was offered to Health Care Sharing Ministries by Obamacare. In fact, Blue Cross Blue Shield of Vermont has been advocating for this radical move since last year. Please note that of the 18 comments submitted by the public to the working group last year, 13 were about protecting the exemption for sharing ministries. A sharing ministry is a religion-based group healthcare arrangement in which the members pool together their money via monthly payments, and then those funds are shared to cover the healthcare costs of the members. Representative Bill Lippert, a Democrat and chair of the House Health Care Committee, claims that sharing ministries should not be exempted because they do not amount to health insurance. Then why did Obamacare recognize and exempt these groups? Vermonters who belong to sharing ministries contacted me, and one said that his family would have to forego health insurance altogether should this bill pass because his family would be unable to pay into a system that violates their religious convictions. Despite facing such injustice, many Vermonters feel that they cannot speak out lest their families, farms, and businesses face the ire of activists. Political intimidation in Vermont prevents citizens from sharing their legitimate concerns with the public. This is an important reason why today's dialogue has become my monologue. Vermont lawmakers, Democrat and Republican, maintain that an individual mandate is integral to paying for those with pre-existing conditions. They are wrong. Obamacare subsidies, for which 85% of persons on the exchange qualify, pay for the health expenses of Americans with pre-existing conditions, whereas the mandate concentrates these costs on a niche demographic. The mandate penalizes individuals with an annual income between $10,000 and $50,000. People without employer-based health insurance, like small business owners and those juggling multiple part-time jobs, typically younger people, disproportionately paid the penalty when the federal mandate was in place. And now Montpelier is resurrecting this inequitable system. When premiums and out-of-pocket costs greatly exceed the penalty, many forego health coverage. Census data shows that Americans aged between 25 and 34 years form the largest uninsured group. Now, some might argue that younger people do not purchase insurance because they are healthy, but a 2016 Harris poll indicates that they increasingly cannot afford it. Pro-mandate advocates also contend that it will keep the number of uninsured low. In fact, studies demonstrate that the federal mandate had no discernible impact on the proportion of uninsured Americans. Finally, sponsors of the Vermont mandate say that it will stop wealthy persons who deliberately shun coverage from free riding the system when they fall ill. This is another inaccurate claim because free riding accounts for a mere 0.67% of national health care expenditures. Cost-effective alternatives to the mandate exist. One, we can offer slimmed-down plans with low premiums for catastrophic coverage to incentivize the young and healthy to remain in the insurance pool. And two, we can create separate high-risk pools to focus greater subsidies toward the tailored medical care of Americans with pre-existing conditions. Maine operates a very successful invisible high-risk pool, which could serve as a wonderful model for Vermont. We can look after society's most vulnerable without arbitrarily taxing some and depriving all of the freedom to choose. A 2008 Obama campaign mailer sums it up well. Punishing families who can't afford health care to begin with just doesn't make sense.